case number 9. Case number 9, we choose for this workshop a combination between Wolf Ureteroscope. This is a hybrid ureteroscope. This ureteroscope is very particular. It's a part, it's semi-rigid part, and this one is flexible. This one is 8.1 French, and this one is 9 French, a little bit bigger, the flexible one. What is the indication of this kind of ureteroscope? You know, be fair and be honest. In many countries, semi-rigid ureteroscopes are still using. Semi-rigid ureteroscopes are really very good. We can use 1,000 times, no problems. And also, for ureteral stones, still in our department, we use this semi-rigid ureteroscope. It's really a very good tool. Economically, it's very good. The image is very good. And, of course, in the same time, you know, the view and also the manipulation is perfect. So, nowadays, it's another trend. There are another trends. I know. It's flexible, yes. A lot of surgeons, a lot of urologists propose to completely replace the semi-rigid with flexible ones in order to treat in the same time, of course, the ureteral stones, and if it is you know, a complication, some fragments move into the kidney. It's very easy to treat the stone using one single ureteroscope. That's why this combination between semi-rigid and flexible, it's very, very interesting. And this is for Wolf. You can see the deflection. It's really great. And also on the other part is the same, the deflection is also very, very good. Okay, so this is the advantages of this one, you know, is very clear. For ureteral stones, for example, or ureteral pathology, and also for concomitant for upper urinary tract pathology, especially for lithiasis. So this is a very good tool. We work with this one. We presented our experience in AVA in 2024, and it is a presentation there in EUS that you know, I appreciate a lot this tool. Sometimes, you know, this tool, because it's multi-channel. Multi-channel, that means it's in-floor, out-floor, and of course, these two tools. This one is for laser, and this one is maybe for suction or for secondary access instruments. It's impressive because we have, you know, this possibility to use in the same time two instruments. Very good idea. And also the combination between semi-rigid and flexible one. Also very good idea. So this is the instrument. We will try to use this one. But if we have some problems, because the stone it's in a difficult position, we will also use for Wolf also the flexible one. The flexible one also is this one. The flexible one, it's a very good also tool. It's it's a scope. It's very, very good, and we work with this one. Yes, it's reusable, but if you know perfectly to use this reusable, we already published. We can use such a scope in more than 100 cases, because usually you know, there are 50 cases, around 50 cases. It's live. Okay, now we have to move to present the case, and we'll see. In the same time, it's important to mention we have also Tidor, because we need to know exactly the pressure and the irrigation and also the suction is together. All are together. It's a dream. Now it's reality. And also we have Tidor 4, also with this access sheet Tidor 4 with plus and minus regarding the pressure. You can control the pressure from here. So please present the case.
The case that we'll have now in our OR is a male, age 55 years old, with a kidney stone localized in the middle calyx with stone dimensions of 9, 8 and 6 millimeters, with a stone volume of 225 cubic millimeters, a stone density of 1,400 Hounsfield units, and of course we made the preoperative an urine culture that is negative. We will approach this case with the Single-Use Multichannel RIWO D-Ureteroscope from Richard Wolf with a 9 French flexible area and an 8 French semi-rigid area, and hybrid ureteroscope. We will use an access sheath with suction Elephant 224 from YiGaoMed 2025-2026. The intrarenal pressure control Tidor from YiGaoMed 2025-2026 1113 French. We'll use the Polaris loop ureteral stent from Boston Scientific and the CyberHo laser generator Magneto from Quanta system from 2025.
So now we will start our procedure with D-RIWO Wolf, and we have already placed the access sheet. I mean the Tidor. I mean the is here. Yes, Elephant 4, and look, move please to the endoscopic view. Yes, it's working. Very good. Now we are near the. Very good. We enter into the kidney now. We are in the kidney. Very easy. And the pressure is perfect. It's 7, only 7. Look, the view is very good. This is the image of this tool. Initially I put this kind of ureteroscope in order to see what happened to the ureter, because this patient had renal colic and it was a stone into the ureter, but in the last minute the stone disappeared. So we will move to, now we enter into the superior calyx. Did you see? It's very easy, very good flexion, despite this this is hybrid. Yes, the image is perfect. Look here, no problem in the upper calyx, and you can see here it's the stone is here. Very nice, the view. And now we will put the fiber. So the pressure is perfect. The pressure is complete, continuous control. No problem. And also for this case, I use Magneto. I love a lot Magneto. It's you saw the performances of Magneto. Magneto is, I think, one of the best lasers that we have now on the market. So now I will try to disintegrate this stone. Look to the quality of disintegration. It's really, really very, very nice. First thing that I am looking is how the stone is disintegrated. I mean the dust. Look, it's possible to treat absolutely great the stone. No fragments. Look, it's so easy and very, very clear. The image is good. The mobility of this ureteroscope also, it's okay. So no problem with this one. Look, it works perfectly. Look, very, very good. Okay, let's go here and here. You can control very well the stone. Look. So I think that this really is a very good option for urologists to use this Magneto. It's Quanta system. We know a lot of Quanta. I told you it's a family, Quanta family. And you know, many lasers have the Quanta technology. And look how we treat these stones. No retropulsion. I can treat perfectly the stone. No. Look here. I need a little bit less the flux. Yeah. Okay, now it's better. Perfect. You remember the stone was here, you know, the calyx was full of stone, and now look, the image is perfect, absolutely perfect. Okay, now we have to treat some fragments that maybe are here in the Polaris system, but there are very, very little fragments, and look, the aspiration. This is absolutely impressive. Look to the aspiration. Is automatically. So the fragments that we treat, were completely out because of the aspiration. So the calyx now it's free, completely free. Look here. Here was the stone, and look into the Polaris system. Is zero stone. Zero stone. It's unbelievable. Look, here there are some little fragments, and here, it's okay. I think that this was a very demonstrative operation for, you know, the performances of this, we are now in the ureter. The performances of Tidor, of Elephant 4, and of course the laser. It's laser tool. It's laser very, very good Magneto. It's best of the best. Cyber 100 watts. And okay, this we finish now the case in minutes, some minutes. Thank you very much. And after a short period of time, we will go to the last case, no? The 10th case. Okay, good. So I think we...